Alright, so we'll be talking about anesthetics and analgesics this week. So we're going to first start with local anesthetics and then get into general anesthetics. And then we'll talk about opioid analgesics and finally non-opioid analgesics. With your local anesthetics, typically you use them to stop pain prior to surgery or the delivery of a child or any sort of like painful procedure. You're going to get like anesthetics. Also, a lot of the over-the-counter products like stuff for sunburn, insect bites, hemorrhoids have topical anesthetics in there. Their mode of action is that they inhibit pain by inhibiting the nerves that carry those signals. And so if you put a local anesthetic here on the skin, that's going to absorb in and it's going to shut down the sodium pump. So it doesn't let sodium come into the cell, which means that cell's not going to be able to depolarize. So even though like the action potential is starting to work, it won't continue down the line because it can't, because that sodium pump is blocked. And that's with like all of our local anesthetics. They all have the same mode of action. They all inhibit this sodium pump or sodium channel. It does it based on nerve fibers, so not all the nerve fibers get numb or get desensitized, and the ones that do it first are going to be your type C fibers. You have type C, B, and A fibers. These fibers are named on the diameter, how big they are, if they have myelination, and then how fast or slow they conduct. And of course, the bigger something is, and if it has myelination, it's going to conduct faster. And so typically these type C fibers are small, unmyelinated fibers. And so all across the surface of these fibers, your local anesthetic can work and stop them from sending their signals. You see, it also works pretty good on type B fibers, on your pain fibers, pretty good, pain and temperature. But then when you start getting down to touch and pressure, not so good, and really poorly on motor, which is good. So like you can put it on your skin surface and you can still move your arms and stuff, and you can feel some pressure if something's like cutting or poking on it, but you're not going to feel any of the pain. Or if they're using like cauterizing agents, if they're burning stuff, you won't feel any of that. It's just a little bit of pressure and you're able to move it, which is cool. It works really great. Our local anesthetics are broken down into two major groups, where you're going to have your esters and your amides. These two differ in the duration based on the metabolism and their potency. So typically, your esters are quickly metabolized. So you're going to find choline esterases in the blood and the skin that break down your ester local anesthetics. Benzocaine is one that we do see sold over the counter. You see it in your sting kill swabs. You see it in like those sunburn treatments. You'll find benzocaine. Cocaine is an ester. Cocaine was like the first local anesthetic that was discovered. And if you look, all of your local anesthetics are ending in cane because they're all kind of based off of cocaine. So cocaine was the first, and then like procaine, and less addictive types of local anesthetics going down from there. When we get to our amides, so again, like duration is different here. Proparacaine, you see, it goes from like 30 seconds to just a quarter of an hour, so 15 minutes. 30 seconds, 15 minutes max, right? Versus lidocaine here, that can go up to 3 hours. So your amides, these are going to be in the system a lot longer. It's in the system a lot longer because they're metabolized by the liver. with your esters, again, these are metabolized by the skin and blood because they have those choline esterases. Your amides, metabolized by the liver, so they have to get into the circulation and then get broken down. A lot of these, especially like your lidocaines and stuff, are going to be vasodilators. And so if you put it on your skin or in that area of injection, the vessels are going to dilate, and so that area might become red, maybe even a little puffy. To counteract that and to keep them around longer, sometimes they're mixed with epinephrine. So epinephrine will cause those blood vessels to constrict, and that way your anesthetic isn't carried away in the blood going to the liver. We also have combinations, and so IMLA is a really common one that is used now, especially for topical stuff. You put IMLA on the surface, wrap it in plastic to help facilitate bringing it down into the skin. It's really good for whenever people need to get like injections and things like that. LET, which is a lidocaine, epinephrine, tetracaine combo, is being phased in more, while TAC is being phased out more. So TAC is tetracaine, adrenaline, and cocaine. And so as a local combo, this one's getting phased out, this one's being phased in. But really, IMLA is like the gold standard here of late. So with our local anesthetics, either your amides or your esters or your combos, like whatever, you'll see that some of them are topical, some of them are injections, right? So we can either do it topical, just on the skin surface, or parenteral in these injections. And for a lot of your local anesthetic injections, you're either going to be doing intradermal, so injecting into the dermis. This is for like skin surgeries to have stuff removed that way, or any kind of orthodontic work. You can also get spinal injections. You can get a spinal nerve block that goes into the subarachnoid space to kill all those nerves, to numb all those nerves in that area. You can also get an epidural or a peridural nerve block. Epidurals are really common in childbirth. So they come into this space that is just above the dura mater of the spinal cord and inject in a local anesthetic to ease the pain of childbirth. You can also get caudal blocks or paravertebral blocks. The paravertebral are going to just be numbing the nerves right here that come out next to the vertebrae. Some other local anesthetics that aren't really like drugs are going to be these surface cooling agents like ethyl chloride or alcohol or menthol, and it's in this thing called cryoanesthesia. And so you can use like ice or these cooling elements to bring down the temperature, and that helps to deaden that area. It's really good for like superficial skin lesions, or when you get laser treatments on your face. A lot of those machines will first cool it and then blast it with the laser to decrease a lot of that pain. There can be adverse effects to local anesthetics, especially if you get a lot of it. It can get carried in the blood and go to different parts of the body and have their effects on those different parts of the body. The numbing, not a huge issue, but the vasodilation could be. And then cocaine. While most of these are vasodilators, cocaine is actually a vasoconstrictor. And so cocaine is still used in some medical treatment, especially for eyes or nasal mucosal surgery, because it is a vasoconstrictor. And so it's going to constrict those blood vessels in that area. That's also like why you see in movies and stuff if somebody does a lot of cocaine or whatever, they're going to get nosebleeds. That's because it constricts those blood vessels, which dries out the mucosa, which makes it good for when you need to do surgery on mucosa. And it's that dried mucosa, consistently dry mucosa, it can cause nosebleeds. Using cocaine or not using cocaine, seasonal allergies can do that too. A lot of your local anesthetics are going to depress the cardiac conduction, and so they can cause arrhythmias whenever you have toxic amounts of them. So when you have more local anesthetic than you should, it can cause cardiac arrhythmias. Wow. But lidocaine can actually be used to treat arrhythmias in more mild doses because it is a depressor of cardiac conduction. So it can help balance out that arrhythmia. Of course, in large doses, it can cross the blood-brain barrier. It is lipophilic. All these are lipophilic. That's how they're able to get through the skin to work on those nerves. And so in really large doses, they can cause tremors or nervousness or even coma. That's why, like, when you see shows like Dr. Pimple Popper or something, if somebody has, like, a ton of stuff, they're like, okay, we can only do a handful of these because they're using local anesthetics. It's like, you can't just, like, cover your whole body in local anesthetics because that's too big of a dose and can cause coma or death. And so you got to make sure to do the bare minimum, right? Don't go overboard on this stuff because you can give heart attacks and comas. Of course, with all things, allergic reactions are possible. Stuff like rashes, swelling, anaphylaxis. These do have an FDA black box, like bupivacaine. It's not recommended for obstetrics because it can cause cardiac arrest. And what an FDA black box is it is literally just a black box in the FDA approval saying, don't do this. This is a bad idea. I know it sounds much more mysterious than it actually is, but yeah, just a black box where it is dangerous to use this drug. Like bupivacaine. Don't give it to pregnant people or any obstetric surgery. Alright, and so that is it for our local anesthetics. The next group is general anesthetics.